This instructional video has been created to offer you a step-by-step guide to help ensure the best possible outcome following your Mohs surgery. This information is for educational purposes only and does not take the place of instructions or advice from your physician. Be sure you watch the entire video before you take any steps to care for your surgical site. You've likely had one of 4 types of repairs: a linear closure, a flap, a graft, or a site that heals naturally, also known as healing by second intention. A fundamental and very important post-operative rule is that you relax and take it easy. It's a good time to watch your favorite TV shows, read a good book, take a nap, or listen to music. Whichever you choose, it's critical you stay quiet for the first 48 hours. Avoid any exercise or exertion to help reduce the risk of bleeding. This includes common activities like working out, golf or tennis, swimming, gardening, and house cleaning. Even bending down to put on your shoes, walking your dog, or lifting your kids or grandkids can put too much pressure on your surgical site at this early stage. If your surgical site is near your mouth, you should avoid talking as much as possible. It's important to take care of yourself during your recovery. Eat a healthy diet and stay hydrated. Avoid smoking and drinking alcohol. It's also generally advised to keep your dressing dry for the first 24 to 48 hours. Above all, be sure to carefully follow your physician's instructions. It's normal to experience some discomfort. Pain is a subjective feeling. The amount that you'll experience will be determined by your individual tolerance. You can control most post-op discomfort with over-the-counter medication or, in some cases, with medication your doctor will prescribe. It's important to start pain management early. If you stay ahead of it, you'll lessen its intensity and duration. Any discomfort should gradually improve after the first 2 to 3 days. Swelling and bruising are also normal and expected. You may develop swelling and bruising on or in the areas adjacent to your surgical site, such as the eyes, lower cheeks, and neck. Often patients will experience more swelling in the morning hours after lying down in bed. You can help reduce the swelling and gain mild pain relief by performing cold compress therapy. Apply an ice pack or bag of frozen peas to the surgical site for 20 minutes every hour on the day of surgery until bedtime. It may also be beneficial to continue icing the surgical site over the next 1 to 2 days. Some bleeding is also to be expected. You may see blood stains on the edges and in the middle of the wound dressing. If your dressing becomes saturated with blood and/or blood is dripping from it, apply direct pressure on it with a clean cloth, tissue, or a piece of gauze. Hold it firmly for a full 20 minutes without peeking. If the bleeding doesn't stop, repeat for another 20 minutes. If it's still bleeding, contact your physician's office immediately or go to the nearest emergency room. After 24 to 48 hours, it will be time to remove your dressing and replace it with a fresh one. If you're on blood thinners, then you may need to wait longer, so be sure to follow the advice of your physician. Before you begin, you'll need to set up the following supplies: clean water in a clean container, soap, cotton tip applicators, ointment as recommended by your surgeon, petroleum jelly is the most common, non-stick Telfa dressings, gauze, adhesive tape, scissors, and a plastic bag and a trash receptacle to receive the old dressing. Please note that if you've had a skin graft or a staged repair, you will need to follow your physician's instructions. Next, you'll need to remove and properly dispose of your dressing. Before you begin, thoroughly wash your hands with soap and water. Then gently remove the dressing. You can do this by moistening one corner, then holding the surrounding skin with your non-dominant hand, and then lifting and peeling it back towards the wound with your dominant hand. If it's difficult to remove, moisten it with additional water. Or, at this point, you may find it easier to go into the shower and let the running water loosen the dressing for you. Your soiled dressing is contaminated biowaste, a hazardous pollutant. If not properly disposed of, biowaste can contaminate our water sources, the soil, and cause serious sickness in both animals and people. To help keep our environment healthy, it's very important that you take the proper steps to dispose of your soiled dressing. First, place your soiled dressing in a plastic bag and seal it securely, either with a Ziploc, twist tie, or a square knot. Then place it in the trash receptacle. Do not place it in the recycling or the compost bins. Then, wash your hands again. Next, you'll need to clean and evaluate your wound. Saturate a piece of gauze with water and hold it against the wound to soften it. Then wet a cotton tip applicator with water and gently roll it up and down the incision until it's clean. Once you have cleaned the incision, your next step is to inspect it. Once you remove the dressing, you may find that your wound has been closed with staples, glue, skin closure strips, or held together with stitches. Regardless of the type of wound closure used, a normal wound can look slightly pink and perhaps a tad swollen. If on inspection you observe separation of your stitches, active bleeding, puffiness, expanding redness, extreme tenderness, worsening pain, warmness to touch, or if it smells malodorous, you see pus, or if you are experiencing a fever above 101 degrees, chills, nausea, or vomiting, you should call your physician right away. To put on a fresh dressing, first apply the ointment evenly along the incision. Cover the wound with a nonstick pad, and then cover the entire dressing with adhesive tape. In some cases, you may find it's easier to cover the wound with a simple bandage. When you are done, wash your hands again. You'll need to change your dressing once a day until you have your sutures removed or you are directed by your physician. If you received dissolvable sutures, your physician will not need to remove them. They will usually dissolve in 10 days to 2 weeks. However, do not be concerned if they dissolve earlier or later than expected. You may also see some extra redness on or around the wound as it heals. You'll need to change your dressing once a day for approximately 10 days. If the wound has been covered with skin closure strips, remove the pressure dressing after 24 hours and then follow the advice of your physician. You should avoid applying cosmetics, scar improvement remedies, sunblock, or creams to your wound until you are advised by your physician that it is safe to do so. It's also important to avoid strenuous exercise until your physician tells you it's okay. If your surgical site is on your head or neck and during your post-operative healing you need to wear a protective face mask due to a pandemic or poor air quality, it's important to keep it clean and avoid situations where you need to wear it for prolonged periods of time. To avoid skin cancer in the future, avoid prolonged contact with the sun, especially 10 a.m. to 4 p.m., use a broad-spectrum UVA/UVB sunscreen with an SPF of 30 or higher every day, avoid tanning and UV tanning beds, self-examine your skin on a monthly basis, and visit your dermatologist for regular checkups. Your surgical site will undergo numerous changes over the next several months. Initially, the suture line may appear raised and swollen. This is known as eversion and is common in the early stages of wound healing. Over the next 12 months, the color, contour, and texture of your surgical site will continue to improve. Some numbness and/or tingling around or near the surgical site is not uncommon and should also improve in the weeks or months following surgery. Taking proper care of your surgical site early on improves the likelihood of the best cosmetic outcome, and you can rest assured knowing that your Mohs surgery has optimized your cure rate.